Hello, my name is Brian Cabral, and for my presentation, I'll be talking about the needle exchange programs. Before we talk about needle exchange programs, we should probably talk about the opioid crisis. For the past 30 years, the illicit use of many prescribed drugs, such as morphine, oxycodone, and methadone, has increased. These drugs are known as opioids, a class of drug found both illegally and legally prescribed as pain relievers. The addiction to these drugs creates the foundation of opioid epidemics across the country. The issue started when pharmaceutical companies falsely claimed that opioid addiction would not be a problem in the late 1990s, which led to the overprescription of these substances. The opioid crisis is something that's been growing in different parts of the country for years now, as stated in this CNN report down below. Like in the short video, Know the Truth of Rebecca's Story, 80% of addictions with opioids start with an injury that is severe enough to require surgery of some sort. After surgery, the patient is then prescribed opioids such as oxycodone or morphine to treat the post-surgery pain. In the case of Rebecca, she's suffered from an ankle injury at cheerleading practice at the age of 14 when she was prescribed a bottle with enough dosages for 2 months. After these 2 months of continuous use, she fell a victim to addiction. She was unable to receive more prescription, therefore causing her to turn to the illicit option of heroin. Opioid dependence in 2016 has reached the lives of over 2.1 million people and has been labeled as a public health emergency by the U.S. Health and Human Services Department, as the death toll marks over 42,000 the same year. Heroin is one of a number of illegal street drugs that is taken intravenously with the use of needles or syringes. Victims who partake in the intravenous drug use typically do so in small groups of other drug users, where instruments, including needles, are shared among the group. The sharing of these needles in the groups promotes the spread of blood-borne diseases such as HIV and hepatitis B. One extreme example of this was in Scott County, Indiana in 2015, where 181 new cases of HIV were diagnosed, which were linked to the sharing of needles in intravenous drug users. Syringe exchange programs are facilities whose main purpose is to supply the disposal of used needles and supply users with clean ones in an effort to lower the rate of shared needles. The highest rate of HIV occurrence in needle-using drug users actually peaked in a short time after the first legal needle exchange program was established in the 1990s, with a rate of 40%. Because of this, needle exchange programs received a lot of backlash, and many associated it with the promotion of drug use rather than an effort to retain it. There was so much controversy that it reached a national level when a press conference during President Bill Clinton's time in office was originally set to touch upon the lift of the ban regarding federally funded needle exchange programs, but was later disregarded because of the lack of subsidy. This received a lot of remarks because at the time, the National Academy of Sciences and the Institute of Drug Abuse conducted studies showing its benefits. To name a few, there has been a decrease by 70% in new HIV cases. The rate of HIV infections via intravenous users has decreased to 6% in 2015 when it was 40% in 1993. Naloxone, a drug used to block opioid receptors and terminate an overdose, is supplied to drug users, families, and first responders. Users involved in needle exchange programs are 5 times as likely to begin treatment for substance use disorder. Needle exchange programs also supply screenings for diseases like hepatitis and HIV, and there's no data that proves that there's an increased rate of drug use or crime when going to a needle exchange program. It is clear that syringe exchange programs supply a resource for those who suffer from intravenous drug addiction, not only with safer measures regarding efforts of disease prevention, but also a facility where these users can seek help and take their first step towards sobriety.